Hello everyone, in this video we are going to see about the most common cause of hospital acquired infection. Okay, that is UTI or urinary tract infection. So we know UTI divided into two different categories, so that is upper UTI and lower UTI. So what do you mean by UTI? Here is the microbial contamination or microbial infection which involves kidney, ureter, bladder and urethra. So if it involves kidney and ureter, then we call it as upper UTI. It involves lower uh, portions, that is bladder or urethra, then we call it as lower UTI. Okay, so how we get this infection? So routes of transmission, if you observe, ascending infection is most common, descending mainly through the hematogenous route. Okay, very rare, but if you have some bloodstream infection, so through the hematogenous route it can we can get the UTI. So now we'll see what are the predisposing factors mainly. Okay, so coming to the predisposing factors here, female are more prone for this UTI. Most common cases we can see in the females. Okay, then sexual activity and pregnancy is the predisposing factor where we can see most UTI cases. Then if you have any obstructions in the flow of the urine or enlarged prostate or kidney stones, renal calculi, right? So these are the major predisposing factor to get the UTI. Okay. Then coming to the causative agents of UTI, sometimes they may ask you for example for the organism which causes the UTI, right? So coming to bacteria, we have so many bacteria which are responsible for UTI. That is the most common one I'm telling, that is Escherichia coli, Klebsiella, then Enterococci, Pseudomonas, Protease, then cons. Okay, then cons means coagulase negative Staphylococcus aureus. Then coming to fungi, we have Candida species. Coming to virus, we have adenovirus type 2. Okay, so how we diagnose this? Okay, so if you take hospital acquired infection, 40% cases we are getting UTI, commonest cause of hospital acquired infection. Okay, so how we diagnose this, or what are the sample? Okay, the main thing you should remember here is we are going to collect the midstream urine. Okay, in catheterized patient, always remember we are taking sample from the catheter, not from the collecting bag. Okay, so in infant, urine may be collected by the suprapubic aspiration. So if any delay in the transportation or if the urine is reaching late to the laboratory, so we have to refrigerate it. Okay, so why we have to refrigerate is urine is a rich source for organism multiplication. So if delay is there, refrigerate it. Okay, so you can stop the multiplication. Once we receive inside the lab the urine sample, we do wet mount or gram stain and we look for pus and bacteria. Okay, so sometimes we may miss out in the microscopy, then we have to do the culture, whether it is asked or not we have to do, because the sometimes very low count is also very significant in some cases. I'll discuss that in later slides. Okay, so generally it is inoculated onto blood agar McConkey, and if you have clad media it will be very useful. Okay, so how we will do this culture is we take 4 mm loop. Okay, standard loop. So in that one loop full of urine will take approximately 10 microliter of urine it will hold. Okay, then we spread to the whole culture plate See here, like this we are going to do in a zigzag manner. Okay, first we do one straight line, then second we do the zigzag pattern. So why we do this? To get the growth like this. So we give the CFU per ml, that is colony forming unit per ml of the urine. Okay, if 1000 colonies are present approximately, then for 10 microliter we have taken one loop full of urine, which is approximately 10 microliter of urine is equal to 1000 colony. So when you do the counting, okay, then you will get 10 to the power of CFU per ml of the urine. Okay, so that's why we are not doing streaking plate here. So instead of that we are doing zigzag manner in a clad or blood agar media, and we are next day after incubation we are going to count the colony forming units. Okay, so how we will interpret this? If more than 1 lakh organisms are there, that is approximately 10 power of 5 CFU per ml of urine in midstream, okay, then it is a suggestive of UTI. Doubtful significance, less than 1 lakh, okay, but approximately 10,000 CFU per ml. So this count may be due to contamination or delay in the transportation. We have to repeat the culture. So if it is less than 10,000, non-suggestive of UTI. If it is collected from the catheter or suprapubic aspiration, we have to consider this. I told you, right? So there are several factors which may influence the count. If it is from the catheterized patient, if it is from the infant, so then less count is also we have to consider. Okay, and in case of pregnancy, okay, asymptomatic bacteriuria we call it as, okay, pregnant women may have UTI without any symptoms. Other methods for urine culture, we can go for pore plate also. Okay, generally we do the entire zigzag semi-quantitative culture method. Okay, so if you are not able to do this, or if you can go for semi-quantitative also, that is pore plate method. Okay, why? Because in pore plate method also, it is also semi-quantitative method where we can quantify the colony growth. Hope you understood the concept of UTI, urinary tract infection.